say travel history. But now, since it's within the community, we can't say travel history. Perhaps that's why the doctors are suspicious. When they see such symptoms, they quickly refer to the patient for testing. So I'm just saying maybe that is why. But, hello?
I'm here, ma'am. I'm listening to you, and everybody's listening to you as well.
The doctors are also protecting themselves. Of course, you're right. Because right now we don't have enough personal protective equipment that can go around every single doctor. And personal protective equipment are key. They have about over 100 doctors who have fallen ill of COVID-19. And we don't have enough doctors in the country anyway. We don't have enough doctors. And when we have them falling ill in the face of this pandemic, that will also be dangerous for the country. So I expect that one of the challenges and constraints they have is that they don't have enough PPEs to protect themselves when they are seeing patients. So that's one.
Okay, I do know you should be in touch with the National Air School since you're the chairman for Rivers State. Have you people made like a formal, because from the 113 doctors that are already infected with the COVID-19, with the 130 people who are already infected with the COVID-19 at the moment, the doctors, 70% are from the private hospitals. You know, could this be their fear? Is this why they are telling people back? Because at the end of the day, if there's no solution, we might end up having a crisis. And the crisis will not be recorded because so far, what we've had are deaths that have been recorded from COVID-19. Nobody's talking about these other deaths that are happening.
Yeah.
Some of them are unrecorded, you understand? So basically, looking at this, as an association, has NMA had a discussion with NCDC or the Ministry of Health explaining their constraint as a body? Because they are supposed to protect their members who are doctors working in both private and government hospitals. Have you people made any formal complaint or tried to have a meeting or try to meet or have a synergy with NCDC to tell them your constraints and to see how it can be checked and how a solution will be preferred?
Thank you very much. I'm surprised you're asking this question because NMA has been in the forefront of this fight, and this has been one of the major reasons and the major constraints and what NMA has been talking about. Go to the newspapers, several press releases. The NMA has been talking about this forever, and the private doctors are part of NMA. Make no mistake, the fight of NMA is for everybody, not just for private doctors. So the private doctors are also part of NMA, and NMA is speaking for everybody. So, and if you do your research properly, you will know that throughout this campaign, the Nigerian Medical Association's president, secretary, members at different levels have all been on the air, and they have engaged NCDC, and the NCDC knows. So that is not the question. The NMA is at the front.
But ma'am, your complaint earlier on is contradicting with your.
It's not contradicting. I said it's not enough.
Can you let me connect it? Can you let me connect it? You complained about not having PPE. Your members not having PPE.
Excuse me, please.
Okay.
You asked me what is their constraint.
Okay.
I said that is it. And NC tell you again ask whether we stop to NCDC, and I'm telling you that from the beginning the NMA has been in the forefront.
Okay.
It's not that we have to complain to NCDC now. NCDC knows about it.
Already, okay, beautiful. All right, okay, go ahead.
They also know that we don't have enough protective equipment. Even the NCDC knows, the health ministry knows, and they've been talking about it. That was your question.
Okay.
You asked if we are, and I'm telling that the NMA from the beginning of the pandemic has been talking about it.
So in other words, NCDC is not doing enough.
Well, that is for you to deduce. It's not for me to say. If you think NCDC is not doing enough, that is for you to deduce.
Because if you have communicating with them, ma'am, if you have already been communicating and you've already...
Don't say if you have been communicating. There's nothing like communicating with them. If NMA says her doctors doctors in different institutions say we don't have enough PPEs. They say it, and this NCDC is aware. And I'm not thinking that it's NCDC's duty to provide doctors and other health workers.
I also mentioned.
So they know, they are aware.
I also mentioned the Ministry of Health earlier.
Words into my mouth and don't twist my words. The materials, that is the bottom line. Why are the doctors? I said maybe. If maybe the doctor does not have enough personal protective equipment, that's one part. That's one part. To supply.
So what do you think? What do you think is the way forward? How can these be checked? What do you think is the way forward? How can these Ministry of Health? How can these and they can that are sick?
It's for the government, and the government have to. It's not MMA that will go to the government and provide PPEs for the doctor. That's his bottom line. Once the PPEs are there, you can be sure doctors will do their duty.
Okay. Can a visitor, so a deceased brother, a relative to a doctor refusing to treat them sue? Can they get just? Is it to refuse to treat a patient that is sick?
I don't know where you're coming from. If a doctor looks at a patient and does not have the capacity to treat, he will surely refer the patient. The patient has the right to the clinic or a hospital, and they feel that they don't have that time to provide the care you need. They have the right to refer you.
In this case, there was no referral, ma'am. They were turned back and said they told them to go get a COVID-19 result. It wasn't a referral.
If the patient feels that, well, I don't know, they answer like we were discussing. COVID-19 is